a lot of people are afraid going on to Medicare because they think that they're getting old, they're not going to get the same type of coverage.
Right.
They don't realize how good of a benefit they're going to get once they cross that line. But their alphabet, instead of just A and B, they added C and D. That was in 2005. They revamped the industry.
Yeah.
All these bells and whistles. But now, again, Medicare is cleaning up the industry because that's so misleading when you had all these celebrity actors on there like Joe Namath and all these clowns saying, look what they did for me, and none of them have a Medicare Advantage. They all probably have Medicare Supplements.
Okay.
Because they're all, hey, there is light at the end of the tunnel.
Right. So George, it's so nice to have you.
Oh, thank you for having me.
Yeah, of course. So you built a very impressive career here on the Treasure Coast. So could you tell us how it started and I guess how you got your beginnings in this industry?
Well, I mean, it goes back decades.
Okay.
But we could probably sit here for 24 hours and talk about it, but I'm going to kind of give you a quick scenario of it. I was in a different type of business in the past, before 1987, of course, that took up a lot of my time, okay? And it wasn't fair to my family. And I had a friend that was in the insurance industry, okay? And, he had a pretty balanced life, 9 to 5. I'm thinking, man, he's only working 9 to 5. And he would always tell me all these stories about people that he met throughout the day and how gratifying it was. So I started picking his brain. So how do you get into this business? And he says, oh, it's really easy. All you have to do is just get the manual from the insurance department of the state of Florida and study, the insurance exam. I studied for the insurance exam. So I made a conscious decision to give it a stab because I went out with him a couple times. I enjoyed what he was doing. I enjoyed listening to people, what their needs were, and him helping them with their needs. I thought it was really good. So I got myself licensed and I went to work for the same company that he was working for or representing. Before you know it, I was promoted to management in that company. We were growing tremendously. I was one of the individuals that would go around the state of Florida, pick out locations and open up offices and hire agents, get them licensed and train them, mentor them, of course, teach them product lines, making sure that they understood what they were representing. But then after a little while later, the company started heading towards product lines that wasn't gelling with me.
Okay.
And it was not ethical. So I decided to separate myself from that and open up my own agency at that time. And I hired brokers or licensed insurance agents. We did very well. But I found myself going back to the same scenario of working long hours, not enough time with the family. And I decided to just become a one-person show. So I went on my own and I gave them all releases and went on my own. And then my wife joined the practice and then we hired an office manager and now we have a really nice team 38 years later. But I went in the direction of helping people and making sure that I understood their needs, making sure that they understood, what the nature of the insurance plan was all about. Team that we don't want one of our clients listening to their neighbor's insurance agent about a product line that was not presented to them by American Senior Health Services. So we're ahead of the curve on that.
I love that.
Yeah.
I love that.
Yeah.
So I was going to ask you what inspired you to start this, but I mean, I think you kind of answered it.
Yeah. What inspired me was I needed a change in careers.
Yeah.
I needed something that was more balance, spend more time with the family too, because that's important.
Yeah.
And something that, that I could grow, and that's what we have done. We've grown our business tremendously, and that's basically what inspired me back then.
I love that. And you love helping people, obviously.
We're helping people all the time because, like I said, people don't know how to navigate in this business or in this insurance era that we're in, and it's changing all the time.
Yeah.
So they want you to explain it to them where they can understand it. And that's what we do. Sometimes I can get long-winded, but that's all part of the business, educating our
Yeah.
clients, because our clients walk out of our office, they're educated. If our clients call us, we help them. Okay. So, that's,
Yeah, no, it's great. It's very much needed. I know for my parents, when they had to get on Medicare, they like freaked out. They're just like, yeah, it's just like a lot of stuff that it's an unknown.
it's an unknown.
Yeah.
Yeah, a lot of people are afraid to get rid of that comfort blanket.
Exactly.
At age 64 and 11 months.
Yeah, and you're like, I'm feeling old, or yeah.
Yeah,
Yeah.
or what kind of healthcare coverage am I going to get?
Exactly.
So we explain to them their options. We explain to them how the Medicare industry works compared to the group insurance prior to somebody going on Medicare. And they come to realize that, hey, there is light at the end of the tunnel.
Right.
This looks like a pretty good niche for me, and the cost is how much,
Yeah.
a lot less, yeah, and we put their minds at ease is what we
I love
wanna do.
that.
Yeah.
I think it's a really unique niche
Yeah.
in insurance. I think, yeah, it helps. Um, what would you say over the years has been one of the keys to your company's long-term success? Obviously, you care a lot. Is there anything else you would say?
They see us trustworthy.
Yeah.
Okay. They see us ethical.
Mhm,
Okay. We don't mislead. We don't do any senior abuse. We don't
Mm,
we don't steer business towards a company that might be wanting to pay more.
right.
And I can get into that because I like to explain how Medicare controls all that. But they see what we do for them, and year after year, they take our advice. That's basically about it.
Yeah.
That we don't have a 98% retention level. If it was
Of course.
the case of we just want to worry about
Money.
padding our pocket.
Yeah, exactly. Exactly.
That's kind of like something that we've never done. And if an insurance company back in the day, an insurance company would pay you more for the more you wrote, but they had no doctors. So why would you want to do that to somebody?
Exactly.
But there was a lot of people that worked, from their car. That was our office, which I started out like that. I worked from my car and I did seminars, a lot of different locations, communities, HOAs, all over the place on a Saturday or a Sunday, whenever they wanted me to come in there. And then they would call us, they want us to review their insurance. But there's a lot of different misconceptions in the industry, that it confuses the Medicare beneficiaries, So getting it all out of the way and making sure that the client understands that
Yeah.
you're going to look out after the best interest, because that's what it's supposed to be.
Right.
If you don't do that, you're going to have your phone ringing with complaints, and that's
Yeah.
that's not a good business practice.
Exactly. So, looking back, is there one accomplishment or milestone that stands out to you that you're most proud of?
Yes, we're yeah, myself and my team, most proud of how we have grown our business by referrals, because
Oh, I love that.
98% of our business is referral business.
Okay,
Yeah,
that's great.
which is fantastic. I mean,
Yeah.
we have referrals every day of the week. People
Wow.
calling, especially this time of the year, because we'll reach out to clients that are in need to review their plans or their insurance coverage and show them different options, because we know what the pitfalls are going
Right.
into next year. So we try to make them aware of it. That's that's basically, I mean, that's what we
Yeah.
do.
No, that's great. That's great. So you've been speaking a lot about Medicare. Um, you said the whole landscape has been evolving a lot throughout the years. What have been the biggest changes you've noticed when it comes to Medicare?
The biggest change is there's been quite a few big changes throughout the decades that I've been in the industry. But the biggest one was in 2005.
Okay.
When Medicare added 2 more letters to the Medicare alphabet. And
Okay.
instead of just A and B, they added C and D. That was in 2005. They revamped the industry.
Okay.
Because when you have 75 to 80 million baby boomers starting to age in, at a rate of 10 to 11,000 a day. Okay.
Wow. Yeah.
Medicare sees this freight train coming down the pipeline, down the tracks, or whatever. Um, and that's when they started privatizing the
Okay.
Medicare into the private sector, having, your United Healthcare, your Humana, your Aetna, your Cigna, do the Medicare Advantage, which Medicare Advantage is Part C of Medicare, and it encompasses it, Part A and Part B, and then they also throw in Part D of Medicare all in one. It's like a bundle.
Okay.
And that's what all started back in 2005 to help the aging population um, uh, getting into Medicare, the Medicare beneficiary. So the way that system changed everything was that Medicare laid down a lot of laws, a lot of guidelines back then, because it was very much abused by the HMOs that were prior to 2005. There was a lot of bad rumors about them. There was a lot of people calling them names, sick enough to die, but not sick enough to stay in the hospital because they get you out of there and get somebody else in there. And then gatekeepers for HMOs that the doctors wouldn't do what they were supposed to do. They were taking the money from Medicare, but they weren't providing the services for the senior citizens. So it had a bad reputation, and it had to be cleaned up. So Medicare cleaned it up in 2005 when they added the extra 2 letters. And that's what you see on television. A lot of people say, hey, do I have Part C? Yeah, you have Part C with your Medicare Advantage. So that's one option that people have.
And is that, I don't mean to interrupt you, just so I understand, is that basically you're like opting in, you're paying more to get more benefits?
No.
Or it's not? Okay.
No, you're paying less and getting more benefits, actually. The way that the Advantage plans work is there's a network of doctors that you have to make sure that's your only job. Make sure that the doctors are in network, or if you go to a specialist, that they're in network or participate with the plan. There's normally no monthly premiums for these plans. Okay. And they include, like I said, they'll throw in the prescription drugs in there with copays. Back in the day, there was some of the PPOs which are better than an HMO. A PPO, you don't need a referral.
Right.
Okay. If your doctor wants to send you to a specialist and they have an opening this afternoon, you can. You don't have to get permission from the insurance company to allow you to go to that specialist for a certain type of condition. So what happens is that back then, the PPOs, they pay fee for service, but there was a monthly premium attached to them. Okay. So down the road, they got rid of the monthly premiums. Okay. The HMOs were the most popular plans back then because the copays were very low. So people still didn't have to pay for an HMO. They had to pay for Medicare Part B, which is a base premium that everybody has to pay.
Okay.
That's the only cost. But comparing that Part B premium of Medicare to a major medical at age 64, it's peanuts compared to the cost of major medical or group insurance. So as the years went on, the PPOs started lowering their copays, and they started getting rid of their monthly premium.
Okay.
So now the only out-of-pocket cost for the Medicare beneficiaries would be the base premium for Medicare Part B.
Okay.
Which this year is $185. Back in the day, it used to be $50 or $75. But anyways, so the PPO's copays came down so low that it was more beneficial to contact your clients and move them out of HMOs into a PPO to give them more freedom of choice of network of doctors.
Okay.
That's one route that people can go into when they go on Medicare. They don't really know all their options, but that one's one that doesn't cost them anything. There's a company right now that pays that Part B premium, the $185. So that person that's on that particular PPO doesn't pay anything, but they have all the benefits of a large network, but they have copays throughout.
Right.
And they have a maximum out of pocket that they could incur if they had, say chemo or kidney dialysis.
Right.
But at least they have a stop loss. Okay. And then it turns into 100% for the rest of the year. No more copays, but they still get all the treatments. Okay. Now there's another route that Medicare beneficiary can choose to go, and that would be straight Medicare, A and B, and then a supplement, Medicare supplement. which is referred to as Medigap, secondary to Medicare,
Okay.
but it's all supplement.
It's a lot of information. This is like confusing.
It is.
I get it. That's why I was like, this is a lot. Insurance in general, I think, overwhelms people. So,
Yeah.
this is very helpful.
Yeah. Yeah. So, I mean, people asking, well, how about a Medigap policy? I go, this is what I was showing you, the Medicare supplement. It's a
Right.
Medigap, it's secondary to Medicare, but
Yeah.
it's going to cost you X amount of dollars every month for a Medicare supplement. The difference between the supplement and Medicare Advantage, Part C, is the supplement gives you freedom of any doctor, any specialist in the United States
Oh, wow.
that takes Medicare.
Okay.
Okay. If they don't take Medicare, then the supplement isn't going to pay anything.
Do most people take Medicare, though?
Oh, everybody should take Medicare
right?
when
Yeah,
they're
okay.
65 if they're not employed. Okay.
Okay.
If they want to stay on the group plan, they can take Medicare when they decide to retire.
Okay.
At a later age. We have clients like that. One example would be somebody that's turning 65, but they're still employed.
Right.
They're going on Medicare, but if they get away from their employer's group plan, then the spouse gets dropped out of it if she's, say 62, 63. So they choose to stay on the group plan to keep the spouse covered under the group plan.
Got it. Okay.
And then when she's able to get on Medicare, then that person, or he or she, will get into Medicare Part A and Part B.
Okay.
They don't have to get into Part B, but Part A is free, so it's okay at age 65. Okay. But no, not everybody chooses that route because to go with the Medicare supplement, it's not cheap.
It's more expensive, yeah.
But it gives you the freedom to any provider out there in the country as long as they take Medicare. And if Medicare covers it, the supplement has to pay immediately. I mean,
Okay.
there's no contesting a claim, no saying, hey, how come you didn't do this or you didn't do that, or the doctor. Or saying that's not covered. If it's covered by Medicare, it's covered by the supplement. Simple as that. But and then the other option is the Medicare Part C, which is your Advantage plans, your PPOs and HMOs, which for the most part is the most inexpensive way to go.
Okay.
But you're not going to have that 100% freedom throughout the whole country.
Right.
For any doctor anywhere. Although in the Medicare Advantage industry, the Part C, the PPOs have huge networks of doctors all over the country. Okay, that an individual can transfer their benefits to that network if they're away for 3 or 4 months.
Mm-hmm.
Every hospital has to accept you through the emergency room.
Okay.
Okay, so they can't turn you away if you don't have
good.
Medicare Supplement and Medicare. So there's a lot of advantages to the Advantage plan.
Yeah.
Okay, if you understand how it works, but it changes every year.
Great.
The benefits can either go up, benefits can go down.
Okay.
So you have to. We tell our clients. We communicate a lot with our clients starting in September, letting them know that there's going to be an annual notice of change coming down
Okay.
their way from the insurance company, explaining to them, hey, this is this year's benefits, 2025, and this is 2026 over here, side by side. So they can see what the changes are going to be.
Okay.
And we send out letters to all our clients, letting them know the enrollment period is in October. If they have questions, please call us after they review their annual notice of change, or call us so we can review other options that might be of interest to you. But trust me, we bring them in and we show them all the different options and we let them choose what's going to work for them the best. But we're going to show them what will work for them the best if they have all their doctors on board, if their medications are covered, okay?
Right.
Which is very, very important. Yeah.
Right. What would you say when somebody comes to you is their most asked question? Is it really, it kind of sounds like, how does this work?
How do you get paid?
How do you get paid?
Yeah.
Okay.
Yeah.
How do you get paid?
How do I get paid?
Oh, interesting. Okay. How do you get paid? Actually.
Insurance companies pay us.
Right. Yeah. This would assume.
The Medicare beneficiary doesn't pay us anything.
Okay.
Insurance companies pay us, but Medicare controls the compensations because it was abusive back about a decade and a half.
Yeah.
We had insurance companies that abused the commission structure. The more that some of the agents were right for that particular company, the more the company would pay you.
I got it. Okay.
But why would you put a client or a Medicare beneficiary in a company that doesn't have any doctors just because you're going to get paid higher?
Well, yeah, and then they're going to come and complain, and it's going to be like a whole,
That's what you call senior abuse.
And that.
Unethical.
Right.
Steering, the insurance company steering, convincing the agent to sell for me because I'm going to pay you more.
Right.
So it all became unravel, and
Okay.
Medicare came along and said, okay, we're going to get rid of all the riffraff, so we're going to lower the compensations by 75%, and we're going to cap everything, every company.
Okay.
So it doesn't, and I explained this to the clients. I said, it doesn't make any difference to any one of us in this office which plan somebody goes with.
Mhm.
The compensation paid by the insurance company is capped the same level with all the companies. But now they can pay less if they want to, but
Mhm.
they cannot pay over what Medicare dictates every year
Okay.
the cap is. Okay. So that's the most,
That's so funny. That's what they want to know how you're going
the
to
most freaking, yeah.
like what's
Or
in this for you?
when we're done, how much do I owe you?
Yeah, yeah. But it's not they're not paying you.
They're not paying us.
Yeah,
No,
that's
no.
interesting.
The insurance companies pay us. Yeah,
Okay.
yeah.
Well, so that should be good for them.
Yeah, it's good for them.
Yeah.
Yeah, they get all this consultation. Each presentation takes an hour and a half to 2 hours,
Wow.
to sit there and explain everything to the clients.
Yeah.
It's time consuming,
Yeah, absolutely.
And, when you have a big product change, like we did back in 2022, we had to move 1,400 clients in a week, in a period of 7 weeks.
Wow.
So we had to get them in there, educate them, show them the difference between one plan and the other,
Right.
let them make the decision and move on. It was all with the same company. They just came out with a better product that
Okay.
we had to make sure that they understood that there was something better, but let them make the decision.
Right.
Okay.
Right.
Yeah.
That makes sense. So, what would you say are some of the biggest financial challenges that retirees face today?
There's a few exhausting their assets,
Mm,
okay, outliving their savings,
yeah.
living longer because of modern medical
Yep.
technology, medicines and everything.
Hmm.
Those are the biggest challenges that they would face, outliving their savings
Yeah.
and living, a good long life due to the facts that we have better medical technology than we did 20 or 30 years ago.
Right.
When I used to hold seminars, I would kid around with the audience and tell them, one of these days with all this modern medical technology, because every day you're saying technology gets better,
Yeah.
of course. But this is 30 years ago, and I'm telling them, I said, with all the modern medical technology nowadays, Mitsubishi's going to come out with electric heart, we put in your programming.
Yeah. Which they literally have now, right?
Yeah,
Yeah.
There's a company that makes hearts.
Yeah. No, it's true. I know people are living longer, which is a good thing. But then,
Yeah.
like, how do you afford
Yeah.
this?
Yeah.
So, have you noticed, like, what do people end up doing?
What do people end up doing? We have a lot of people that are on Medicaid.
Medicaid. Okay. Yeah.
Below the poverty level. They get assistance from the state
Right.
if they qualify. Because we try to make sure that we get to know the client. You have to get to know your client,
Yeah.
what
Sure.
their needs are before we can suggest anything to them, okay? And some of them, are just, they don't realize that they could get help from the state, from the Medicaid program. Annette, one of our member of our team, she will fill out as a courtesy the form for
Oh,
the
okay.
Department of Children and Family to see if that person can qualify for Medicaid depending on their assets.
Okay.
And then if they get Medicaid, then there's a better Medicare Advantage plan for them
Mm.
that Medicare pays the insurance company more money for
Hmm.
to give extra benefits. So it's what you see on TV advertised, the food card,
Yeah. Yeah.
all these bells and whistles. But now, again, Medicare is cleaning up the industry because that's so misleading when you had all these celebrity actors on there like Joe Namath and all these clowns saying, look what they did for me, and none of them have a Medicare Advantage. They all probably have Medicare supplements.
Okay. Okay.
Because they're all rich.
Yeah.
But
Of course, you don't
anyways,
need to worry about it.
yeah. So they're saying, they gave me this, they gave me that, and it's so misleading. People call and say, hey, why don't I have a food card? I said, because your income is too high.
Right.
You don't qualify for that. But now they're cleaning it up. They got rid of all those bad actors, and when you see the commercials coming on TV now, it's more clear. If you have Medicare and Medicaid, you
Okay.
could be eligible for these certain type of
Okay.
benefits.
Not
okay?
misleading.
Yeah, not misleading.
Yeah.
And then you're not hearing anymore, call and see if you qualified.
Yeah.
That is, the zip code, But you still have a lot of outbound calls that call centers are not supposed to be making, because that's illegal also unless you give them permission. Okay.
Yeah, I feel like they still
But-
do. If we're in every industry, I get $1 million a day.
Yep.
Yeah.
And then they wind up switching your plan without you hardly even knowing that they did that for you.
Wow.
So we monitor all our enrollments and our book of business to see who's being terminated, and then call that person, find out if they are aware that their plan is terminating at the end of the month, and have them, no, I didn't do anything. I didn't, they call me, but I answered a couple questions. That was it.
Wow. Yeah.
And it's a process trying to reverse it.
Yeah, absolutely.
So anyways.
So can you explain how tools like annuities and life insurance can provide financial security later in life?
Sure. With life insurance, it used to be 50 years ago, whole life, was very popular. You had, you accrued cash value. That kind of went out the window when mutual funds came along.
Okay.
And then term insurance came along. Term insurance is like pennies compared to whole life. The premiums are like pennies compared to whole life insurance.
Okay.
Much more expensive. Just buy the term insurance, for like a 30-year level premium. If you have a family that's, kids and a spouse, and you want to provide for them in case anything happens to you, or vice versa, but that's the cheapest route to go, and take the extra money and invest it, either in equities or in exchange traded funds. Annuities for a younger person doesn't really work. Okay.
Okay.
There are several different types of annuities, and the most popular annuities in the last 20 to 25 years are variable annuities. The underlying investments are like clones of mutual funds in there. Okay. But they have a lot of guarantees. They have guarantees of an income stream for the rest of your life once you turn it on, even if it goes down to zero. And they also have guarantees for death benefits. So the person passes away, if there's $1 left in that annuity, the estate gets the full amount of money that was invested originally, even though the person collected for 15 or 20 years.
Okay.
So annuities are a good instrument. It's like a 401k. That has predictable and sustainable income, okay, for an individual that's retiring, or an individual that wants to have a guaranteed income stream for the rest of their lives. So yeah, we specialize in that. It's one of my favorite products in the investment industry. It really has helped out a lot of people, especially with those death benefits that are built into it, that are guarantees for the beneficiaries or the spouse or the state, and yet provide a great lifestyle. And if the values grow, their paycheck grows.
Right.
And the value goes down, the paycheck still stays where it was the year before.
Yeah.
At a higher level.
We like that.
I had, during the financial crisis, we had grown men that came in our office crying.
Oh, I can imagine. Yeah.
Because they were going to lose one of the two homes, either the one down here or the one in Connecticut.
Yep.
Okay. And my 401k is only giving me half the money. How much is the annuity you put me in going to provide for me this year?
Right.
And when I tell him, same dollar amount you got last year, you're getting this year. And he says, how is that? Because my value is down by 40% on the annuity. I go, because you invested with a guarantee. Okay.
Okay.
That income stream is guaranteed going forward. It can never go backwards. It can only get higher or the same forever.
Wow.
If you don't have growth in the annuity. And like I said, if the markets do so bad that you have an annuity product that runs down to zero, you put somebody in the wrong product. Okay.
Yeah.
We've never had that ever happen. But if the product has $1 left and that person passes away, the insurance company is on the hook to refund the full amount that person invested.
Oh, wow.
To the beneficiary or the estate. Yeah.
Wow. Okay.
Yeah. And it's good for people that are planning for retirement, around 60.
Yeah. Yeah. Oh, that's great. So you've spent years mentoring others. Is that correct?
Mm-hmm.
So what would you say is one of the biggest lessons that you've passed down, or you are passing down to other people or future generations?
Trust, number one. Be trustworthy, be ethical, learn your product, and educate your clients. I always drove those all the time to all the different agents that I've trained over the years, and friends, that gotten into the business. But those are the main characters. You have to be trustworthy, you have to be ethical, you have to know your product and know your client.
That's great. Yeah. When when you think about the impact you've made through your business, what do you hope people remember the most about you?
Lots of things. I hope that they remember that we steered them into the right direction
Yeah.
and looked out after their best interest
Mhm.
year after year after year after year, which we have,
Yeah.
And as I say to them, I says, I don't need to have you take this insurance to put food on our table. That's never going to be,
Right.
Yeah.
Yeah.
Our motive here. Our motive here is to insure you with the best health plan that, whether you pay for it or you don't pay for it, that
Mhm.
for you, that's going to help you and make sure that you stay in our books forever
Mm.
by taking good care of your needs.
Mm. I love that. It's a great answer. How can listeners, if they want to get in touch with you, what's the best way to get in touch?
They can email us, they can
Email?
call us, either way,
Okay.
It-
You're currently working with new people? They
Oh,
want to, okay.
we work with new people all the time,
Okay, good.
all the time.
And what would you say makes your team different from others in the country?
Caring.
I can tell. Yeah. You actually
Caring.
care.
Yep.
Okay. And you are not getting paid directly from the customer. So
No.
yeah. Okay. I feel
No.
like that's a big one. And do you have a favorite quote or piece of advice you want to leave us with?
Oh, geez. Yeah. I would say for people that are aging into Medicare or looking for an insurance, to go with an independent broker, because an independent broker has your should have your best interests at heart, and they represent many different companies.
Mm,
You don't walk into a shoe store and one size fits all.
right.
Okay. So if you have an independent broker you're dealing with, they're going to, if they know you, if they get to know you, they're going to point out the best option to meet your needs.
Okay. That's great. And do you ever have people call who, they just want to, if say they're in a different state, and you could advise them on who to work with somewhere else? Does that ever happen?
Yes, we have clients that move, back up north to be
Right.
close to the children. I had one this morning that she was telling me she's selling her house and she wants to
Wow.
move back to Kentucky.
Okay.
And I said to her, sis, when you move back to Kentucky, give me a call and I'm going to give you your phone number,
Okay.
or I'm going to give you a phone number to contact a person down here that's licensed nationwide for health insurance, so that he can find you the best health insurance in your area.
Oh, that's great. Okay.
Yeah.
I know, because a lot of people in Florida, they have 2 residences or they're moving and yeah.
Yeah, that's kind of sad because sometimes we have clients in our books that have been with us for over 30 years.
Wow.
Okay, and they're still alive. I mean, I have them over 100.
Wow.
My oldest client was 105.
That's amazing.
She died healthy as could be.
Wow.
Never woke up, the next day.
Wow.
But that's hard when you have clients that pass away that you're so close to,
Of
or
course,
they
yeah.
move away, because you've developed this relationship,
Yeah.
and they count on you,
Yeah.
So, yeah, so we've attached ourselves with people that we know are ethical and trustworthy and know their product line, to help those clients away from Florida.
Yeah.
Yeah.
That's great.
Yeah.
So you know who to reach out to.
Yeah.
So, to learn more, what is do you have you said what's your email, or do you have a website?
We
that
have
people-
a website,
Okay. So, healthyseniorstc.com. Is that correct?
healthyseniorsTC.com.
Seniors TC. That makes more sense.
Mhm.
Okay. All right. So thank you so much. Is there anything else you want to leave us with?
Well,
Not to put you on the spot.
um, nothing else. I mean, this market is it's an interesting market,
Mhm.
and with all the health care changes we're having now, with all the cutbacks,
Yeah.
we're really worried about what's going to be coming down the pipeline year after year when Medicare keeps cutting back.
Yeah.
They did last year, they did this year, and when there's cutbacks, the insurance carriers have no other option but to pass it on.
Of course. Yeah.
The copays get higher, product lines get removed from the shelf, products lines get changed. So that's my biggest concern going forward here, where the industry isn't like it used to be. One thing I meant to mention before we get done here was Medicare pays the insurance companies also to take care of the Medicare beneficiaries. And one of the reasons is because when somebody's on Medicare by themselves, straight Medicare is what we call it, A and B, and they're paying the monthly premium for the B, and then they get a Medicare supplement or a Medigap policy or secondary to Medicare, whatever, there's more abuse, fraud, and abuse with Medicare, straight Medicare, and a supplement because doctors have more freedom. The medical industry has more freedom, actually. So Medicare, when they changed the whole system back in 2005, they told the carriers, we're going to pay you X amount of dollars every month per beneficiary, but you're going to have to burn through 80% of that money. And at the end of the day, you can only wind up with 20% to cover your whole overhead, all your marketing, your staff, whatever, pay George or what,
Wow.
American Senior Health Service. And practice preventive care. So Medicare does pay them up until the year 2022, 80%, they had to burn through 80% of what they were getting paid. This area here gets a certain dollar amount. Palm Beach County gets a certain dollar amount. Dayton Broward gets the highest dollar amount because more claims. But now in 2022, Medicare came along and says, you guys have been doing a good job practicing preventive care, which is what we wanted you to do, because back prior to 2005, the HMO would turn their head the other way for somebody to need a triple bypass and give them blood thinner to avoid a $250,000 surgery, but that person would go back to straight Medicare, and then straight Medicare would wind up doing the bypass.
Right.
Okay. So Medicare was paying them, but they weren't doing their job. So in 2005, when they said, we're going to start practicing preventive care, we want you to catch cancer in stage 1, not 4. Okay. And then in 2022, they came along, Medicare came along and says, you guys have been doing a good job, but now you're going to burn through 85% of the money we pay you, and you have a 15% spread. That's how Medicare pays the private sector. But Medicare wants all the Medicare beneficiaries actually to go into the private sector because they can control costs a lot better than Medicare can by itself. Okay. And that's a story that I share with all our clients, or we do in our office, to explain to them how Medicare works with the insurance companies. And a lot of people that are basically uninsurable or really bad medical conditions when they're coming into Medicare, we tell them to do the Medicare supplement because it's going to be a lot more lucrative for them. They're going to have a flat fee that they pay every month versus the unknown with a Medicare Advantage plan with copays.
Okay, that makes sense.
So better to have a plan that you can see any doctor, especially if they have cancer.
Oh, yeah.
Or they're on kidney dialysis.
Yeah.
Don't even look at a Medicare Advantage plan. Supplement and straight Medicare so you can get the best of the best in care.
Makes sense.
Yeah. So I'll leave you with that.